The World Mental Health Day takes place every year on October the 10th to raise awareness and encourage efforts to support those experiencing mental health issues. MICT commemorated this day on Friday and had a lineup of activities and impactful talks from experts. Its executive director, Dr. Audrey Mate, highlighted practical approaches to improving workplace mental health and financial stability, which are deeply interconnected.
I'm sure most of you get offered jobs that pays really well, but the environment is not the one that is good for your mental health. What do? You decline. Because if whatever happens, you're no longer useful to that organization, they will check you out. They will hire you almost immediately. Then that person also goes through the same cycle. So where you work is important. Don't always follow the money. Follow your health. Because your health you're going to need it all the time. But the money becomes secondary to your health.
MICT staff had relaxation exercises and resources on how to recognize signs of mental health struggles in both themselves and their colleagues. The stigma surrounding mental health facilities was also discussed, emphasizing that seeking help and attending mental health checkups is nothing to be ashamed of. Mental health counselor and medical doctor Byron Bock spoke about the overview on mental health and toxic working environment within the workspace.
We've been hearing a lot about people talking about toxic workplace, having a toxic supervisor, having a toxic manager, having a toxic colleague. Have we ever imagined how that affects your immediate mental health? Some people end up not coming to work because you just don't feel this environment is conducive. Some people deal with it differently. Some people tend to engage maybe now in substance use, start taking up.
Clinical psychologist Micah Iceland explained a theory of the mind on mental health, and if it's not managed well, can lead to burnout, decrease in productivity, and even long-term health issues.
It really does a lot of work. A lot of things are kept in the unconscious. And the reason for that is evolution. When we look at our brains, we got so much more than the animals got. All this stuff up here is very different and in addition to the brains of an animal. So at some point, this poor brain of ours had to adapt a function where it doesn't keep everything in consciousness because we wouldn't survive. We wouldn't focus on the things that we must focus on that have priority.
The event was part of MICT's ongoing efforts to build a healthier, more resilient workforce with plans to integrate mental health resources and support systems into the ministry's regular operations. Johanan Urikos, NBC News, Windhoek.